third of children who have been referred to mental health services back in 2020 since the first lockdown have been turned away. Now, doctors have told the Mirror that they had not been able to get referral to NHS child and adolescent mental health services for years, with one desperate parent selling her house to fund private care. Now, we know that in this country, public services as a whole, compared to certain other more centralized countries, especially in Europe, they're not well class. So we already know not to expect much from our public services in that sense. The people who work in public services, a lot of them actually are passionate and work hard. It's the system, the whole modeling doesn't really work, including the NHS. But having said that, we have had a number of issues with the child services for years. Lockdown, the first lockdown, and this whole thing since 2020 has escalated this issue further, and things are getting worse and worse, yet are being ignored by the same people in the establishment who claim to do all the things that they're doing to us in the name of public health. Well, that's the one example I have. I'm going to give you more examples, but focusing on this one, it's very important. Around 73,000 out of the 195,000 cases were closed before treatment started in the year 2020 and 2021. And the Labour Party have obviously kicked off about this to make it a political point. Of course, it's their job as the opposition, but it is going higher and higher at this rate, and it's kind of a bit crazy considering that a lot of these families are in need. And one mom had told the Mirror that she had to sell her house to pay for £30,000 of private treatment for her daughter, who had a breakdown aged 9. Now, as I've said so many times, as a not as a conservative, but even as a capitalist, there is a reason that certain areas and commodities, especially when it comes to health services, are expensive in this country, is because there's a monopoly of public services. Now, when the monopoly, which is the public sector, fails you, of course the private sector is more expensive, because that's the whole point. The monopoly is being dominated by the public sector. So if you're going to do that, if you're going to have one main centralized machine to help everybody, at least make it efficient. Or don't have it so that the free market brings down the prices for the rest of the private sector. That's the one issue that we had. That's one area that the government, the Department of Health, and the media are ignoring. Another one. We've been talking about cancer. We've been talking about mental health. But there's another case. Dementia. There's a massive, massive issue here. 50,000 cases have been missed during the lockdown. The lockdowns. The 3 lockdowns that we've had. 50,000 cases of dementia. Now, what's going on here? You could either blame, as I said, the public sector, the bureaucrats, the people who created the system, or you could blame the short-term measures of these restrictions and lockdown that essentially abandoned a lot of people in need, those who did not have the virus. But regardless of that, even if it's 50-50, they keep telling us they care about public health. They tell us, the government, politicians, the media, the establishment, the elite, those who go to members clubs and play golf and with their bow ties, but then they talk about how they're in touch with society and how we have to help the poor. So we're going to tell them what to do because people are stupid. We're going to tell them what to eat and what not to eat because we care about public health. If you care about public health, you would do something about the whole system and you would not abandon people in the name of lockdown and public health. That's why it makes me absolutely frustrated when I see stories like this.